I have not had the pleasure of meeting all of you. So very briefly, I'm Dolores Gavier-Widén. I am a vet. I work on wildlife diseases at the National Veterinary Institute of Sweden. And I will speak now about the recommendations that we, ENETWILD, have made regarding a coordinated surveillance program under the One Health approach for cross-border pathogens that threaten the European Union. Ezio presented yesterday the background work that led us to these recommendations. I will focus now on the recommendations. I will speak about the aims and the background very briefly, the methodology, and then go into the recommendations themselves. The aim was to formulate these recommendations and the technical specifications as well for a sustainable and coordinated One Health surveillance for the early detection of prioritized zoonotic pathogens. A long title with, as you can see already in this aim, is addressing many of these wishing list of the European Commission. Of course, we want a very good surveillance system for diseases in the European Union that can address all of these different components. And the recommendations were published as a separate report, as you can see there. No, the pointer is not working, never mind. To make this long description short, I can summarize that we focus then this work on providing recommendations and technical specifications on pathogens that are zoonotic, emerging or re-emerging, for which wildlife hosts are susceptible to, that cross the borders, that threaten the European Union, and at the end, after a long exercise that Ezio presented yesterday, starting with 45 pathogens from a survey for all member states, this was condensed down to a list of 11 prioritized pathogens. So that's the focus regarding the infectious agents. And the surveillance itself, the request was to have a One Health surveillance that will be integrated, coordinated, sustainable in time, also that will still work in the future for a very long time, that will be based on risks. That means the highest chance of detecting the pathogens, that will be feasible and implementable, beneficial, constructive, cost-effective, and focusing on the early detection. All of this was the wishing list from EFSA. The pathogens then, after a prioritization exercise conducted by EFSA member states and many others, the pathogens list is these ones. So these were the infectious agents to focus on. 10 pathogens were aimed at the beginning, but then since echinococcus or echinococcosis can be of two different types given two different disease entities, Echinococcus multilocularis producing alveolar echinococcosis and Echinococcus granulosus producing cystic echinococcosis. These are two different diseases. Then the final list were actually 11 diseases and 11 pathogens. What do we mean with early detection? Early detection of what? Early detection of the onset and the duration of the period of the increased risk. I say now we're having an increased risk. Now we need to go in and test. Or an early detection could also be there is a change in the geographic distribution or spread to new areas. Now this pathogen is coming to these new areas. As early as possible, we want to detect that. Or that it is an increase in the incidence. That's the beginning of epidemics. To have a highest chance of containing the epidemic, we need to find it very quickly. Or it's a completely new introduction of the pathogen. So in all these senses, early detection was addressed. And of course, we can work on diseases, investigate individual animals, test them for pathogens, but we need the information about the whole populations these animals come from. So here is when the importance of the wildlife population monitoring comes into the health surveillance. Why do we need the information on the populations that you're working so hard on when it comes to disease surveillance? Because this is key information for planning the surveillance strategies, because we needed to design then the sampling and the type of surveillance that we're going to do. We needed to analyze and interpret the data. Then we need the denominator data, that's the population data. And also when it comes to communications of the results of the surveillance, we need all those channels of communications, all these networks of experts, professionals, publics, and so on within the One Health. And of course, wildlife populations knowledge is extremely important. And Ezio presented this figure yesterday, and this is a summary of the methods on how we arrived to the recommendations. We started by defining the objectives of the surveillance with focus on early detection. Then we looked at the characteristics of the pathogens. Then we looked at the characteristics of the hosts susceptible to those pathogens. We studied the risks relevant to the early detection of the pathogens in those hosts, and then finally provided recommendations. For example, here we have a table of different characteristics of the pathogens that we looked into. What is a susceptible population? Whoops, what hosts? What are the risks to be considered? What are the host-specific risk factors for surveillance or zoonosis? And so on. I'm not going to go in details of this, is in the report. Here it was regarding the pathogens. Again, I'm backing up. Regarding the characteristic of the pathogens, again, susceptible population, which hosts are receptive then for these infections. How does the transmission looks like for these particular pathogens? Is it a vector-borne infection? What are the risks based on the as a basis for the risk-based sampling? We want to get samples from the areas that have the highest probability then of being infected, for example. What does the disease surveillance look like? What types of surveillance then can be implemented for this particular pathogen? So we looked at the pathogens, and then we could describe the main characteristics of the pathogens for each of them. For example, for highly pathogenic avian influenza, we determine then the objectives of the surveillance. What do we do the surveillance for? What do we expect to find? What are the possible sources of infections in wildlife? What wildlife can act as sentinels, and so on. And then we looked at the characteristic of the host, the wildlife populations, the wildlife hosts, the ecological characteristics, specific risk factors, and so on. What groups of hosts? We looked into several different groups of carnivores. We looked at small mammals, insectivora, wild boar, ruminants. We look at lagomorphs and Bapt's Chiroptera. And we looked at lots of birds as well. For example, for wild carnivores, then we could investigate and map the ecological characteristics that are relevant to the epidemiology for these particular populations, wild carnivores, and the risks to be considered in disease surveillance to achieve an early detection. And then we went on to describe the feasibility of surveillance in wild carnivores. Can we get hold of samples? What kind of samples? What kind of tests? So as you can see, this was a very thorough work that led to the recommendations. Before doing that, we did a risk analysis, and we tried to determine then the epidemiological role of all these species. In this matrix table, you can see here for each pathogen listed in the column to the left, what we believe, based on the information, which is often quite limited, the epidemiological role of the group of species is. Like those in the green, darker green, we know they're reservoirs. White, we know they're not susceptible. And we ended up then with figuring out that wild ruminants, for example, will be very interesting to investigate at least 6 of these pathogens, and that wild carnivores, 5 of the pathogens could be found in them, and so on. Now, let's go to the recommendations. 2 groups of recommendations, general ones, and this is a list of the general ones. I will mention one by one, so we don't need to read the list. First, the One Health approach was aimed at, and this means that we need to collaborate. And of course, this is a recommendation to build that collaboration between human health, animal health, health of ecosystems, and at all the stages of the surveillance, starting from the planning, the design, and this at the regional and national level. This is a true One Health approach. Number two, combine both passive and active surveillance. So here we can discuss definitions on active and passive, but to make it simple, let's say that the general surveillance passive is when we do a pathology examination of animals that are found dead or with clinical signs of moribund. So you find the carcass and you investigate that animal. In the targeted surveillance, when you investigate that animal, it's for any kind of diseases. In the targeted, you conduct a test for one particular pathogen. Oh, what did I do? For one particular pathogen at a time. For example, are there antibodies here against avian influenza? So we recommend to combine both. So the active surveillance then is collecting of samples, usually then on healthy animals on the left. And this is mostly used to monitor and to assess interventions. For example, if we vaccinate a population and we test antibodies in these animals before vaccination and the intervention is vaccination and after vaccination, for example, what has happened? Have the animals developed antibodies now? Or any other type of intervention. So it's to follow up interventions or to obtain other kinds of information that is different from the information of passive surveillance. In passive surveillance, then we investigate the animals that are diseased, individual animals, and then we can detect more easily emerging diseases. Why? Because the animal that is dead is likely to have died of this disease that is new now, and if we do a pathology investigation, we will figure out what kind of disease it is. In the active, you're only looking for one disease or another, you see. So the passive surveillance then will provide us information on other pathogens as well. When you do a necropsy, an autopsy called in humans, then you investigate all kinds of lesions you find and you follow up with microbiological investigations, virology, and all kinds of tests. Also, when you do a postmortem, based on what you find, let's say you find a lung inflammation, you obtain that sample and send to the lab. In an active surveillance, if you take swabs, let's say from a healthy animal, if you don't know then that animal might have a lung inflammation, you may be testing for something completely different. So if you are guided by the lesions you find, then you will test the right sample. Another important thing is when you do a postmortem examination, you can establish the cause of death. And if you do active surveillance, we go for one pathogen at a time. Look, here we have one example, European wild boar. Okay, here we have 4 pathogens that are in the priority list, but maybe later on we want to add one more and one more and one more. How many pathogens per animal or wildlife species in Europe? That would be very difficult, would it? So this is why we need to combine both, those that we're looking for specifically with those that pathology can tell us are present. The pathology is important for preparedness because we need to be ready in times of peace. Time of peace, that means when there is no outbreak, then it's war. Time of peace. So those resources have to be ready to determine the causes of diseases and conduct these pathology investigations before outbreaks arrive, as a part of a disease monitoring. Will tell us about the cause of death. If you do an active surveillance, or if you find a pathogen in a swab and you do a PCR, you will not know if that particular agent you detect by a molecular method is actually the cause of the disease or not. We are only detecting that this is there. What is it causing? Does it mean anything? Is it a pathogen really, or is it another strain? You can find new diseases, you get the right sample, and then you can study pathogenicity of various strains, because if you have the piece of diseased tissue, there is plenty of virus or bacteria there that you can isolate, culture, and further investigate. And you can even do experimental infections, pathogenicity tests, full sequencing to be compared with other strains and so on. And the pathology is very important to assess the epidemiology. You can see the route of infection. If there is a respiratory infection, you will see inflammation and so on in the upper respiratory ducts and in the lungs. And all these different characteristics here will tell us what is the will contribute to assess the epidemiological role of the particular species. For example, is this animal dying of it? It is a dead host. Is it shedding, excreting large amounts of virus, bacteria, and so on? So that information is also needed for assessing the epidemiological role of the different species. Now, we have one problem here, that we don't have diagnostic tests for all the wild animals, right? Because the tests are usually developed for domestic animals. But look, OIE, now called World Organization of Animal Health, has developed here a chapter that is dedicated to validation of diagnostic tests to be applied in wild animals. So this is a working group, and I worked in this working group to provide recommendations to make this validation possible, taking into account the difficulties of obtaining wildlife samples and validating then the tests. Then this disease passive surveillance, one of our main recommendations is that it is very important to have in place in all countries, in the European Union, in Europe and elsewhere. And it requires several steps to be in place. Unfortunately, many countries do not have all these systems in place of passive surveillance of wildlife. You need to find the animals in the forest. You need to send them in packages in a safe way to the labs. You need to report it to the lab and make sure that they want to have it. The postmortem is done. You look at the microscope to look for histological lesions. You send samples for bacteriology, for example, and then all that data has to be stored. And hopefully you can have possibilities of saving samples as well in the freezer, for example, for future investigations. These banks of samples, together with a bank of data, is very, very valuable for future disease investigations. Now, I will move a bit faster now, and let's say more general recommendations are the environmental detection of hazards. Lots of development to be done into this, but we looked into this, we at ENETWILD, and prepared a specific report on this. Another recommendation is to have an adaptive approach. So here, what we mean is that in the wildlife health surveillance, this is a systematic and ongoing collection and an analysis of the information related to the wildlife health. But that information, if that is not disseminated and applied so that a good management is taken into place, then it's useless. So communication is as important as obtaining the samples, testing them, and studying the epidemiology. So we need a big network, and these networks, they need the involvement of the wildlife population monitoring as well, scientists. And this chain of events of the wildlife disease surveillance has to be reevaluated and adjusted all the times. For example, if the sampling design said I needed 100 samples of this species in this place, and I only obtained 10, I need to go back and say why. Maybe logistics problems with the transport long to the closest post office and so on. Again, the observatory, the European Observatory of Wildlife, we also recommend then to use a diverse array of pathogens and to work on host communities assemblages, okay? And here the data from the observatory is very important. To evaluate disease emergence, occurrence in new areas, and so on. This observatory approach, we mean it should complement other classical approaches. And the final general recommendation is to work on a risk-based surveillance that targets surveillance based on risk factors. Which risk factors? Yeah, ecological and anthropogenic. Find what populations at risk are and what the risk areas are, and focus on those areas. That will give us, and on those risk factors, then to have the highest chance then of finding these pathogens. But to do that, we need mapping. We need the knowledge, the information, the data put into maps. Maps of the spatial distribution of the wildlife and the livestock interfaces, maps of the abundance and management of wildlife, maps of presence of pathogens in Europe, maps of presence of different vectors, mosquitoes and ticks, and so on. And this risk-based surveillance then means that we recommend to map the risk areas and to develop then predictive species and pathogen modeling also based on ecosystems data. And In this way, we can, in a wise way, allocate the resources and the efforts. The efficiency of the sampling design then depends on the distribution of both the target populations and the risks. And we think that some of the risk areas are these interfaces between different health compartments. So we want to select surveillance of wildlife where there is an interface between humans or domestic animals and the wildlife, an interface of wildlife populations and ecosystems monitoring where this takes place so that we have that data available, and to apply again the observatory approach. And then we mentioned a few specific recommendations for the surveillance. Based on this risk-based, again, surveillance to target these other interfaces to farmlands, where wild ungulates, carnivores, and other animals then are at the interface with farms. We can hopefully identify those pathogens that circulate between the wildlife and the farm and the farmed animals. The interface between wildlife and pets and humans, as more and more urban wildlife then can become an issue when it comes to also human health. And following again the risk-based surveillance recommendations to target then wildlife that has direct contact with hunters and the consumers of game meat. We also recommend to work more on assessing the role of wildlife as sentinels for a number of pathogens, and then to focus on certain areas and habitats. For example, wetlands, breeding grounds, habitat areas, EU borders when we know the disease is circulating in neighboring countries. We recommend to conduct, again, as mentioned before, an integrated wildlife monitoring. So beyond the One Health approach, not only the health of animals, humans, and the ecosystems, but also incorporating other components of, for example, the ecosystems, monitoring biotic components, and not only the animals in the ecosystems, and even the abiotic components. And the conclusions, finally, the risk factors identified in wildlife and the environment then, in general, and specific risk factors, including the interfaces, should be in focus. We should work on potential surveillance components that were identified with very specific recommendations given in the report for each of these pathogens. We produced this deliverable, the recommendations themselves. We worked on also not only in the wildlife, but we also worked on the domestic components and the vector components. And we define the key target surveillance components in the One Health approach and how to design surveillance plans. And the human components, to some extent, was also taken into account. And I would like to thank all of you, and I have a very special thanks to Joaquin for the fantastic work he has done during all these years, for his patience, and for filling up all the gaps that I could not, because he can work day and night and never sleep, and can produce a 100-page report in 2 days while I'm still working in the introduction. So thank you so much, Joaquin, for the fantastic work you have done.